As parents with small children, all of you will have periods several times a year where your child will have a high temperature. It's par for the course, it's part of the territory, and it will happen. You will not avoid it. And actually, it's the commonest reason for people to take their children to seek medical advice. Because as a parent, you want to be absolutely certain that you're not missing anything serious or dangerous when your child has a fever. And for us as healthcare professionals, we also need to worry a little bit that we're not going to miss anything serious. And it's not as easy as it seems, because when a child is unwell with a fever, the symptoms they have, whether they've just got a simple viral infection or something as serious as meningitis, can be just the same every time. They can be a little bit quiet and lethargic, they'll have a temperature, they may not want to eat and drink, they may be a little bit more irritable, they may be a little bit more sleepy. And sometimes it can be really difficult to unpick when you need to be worried and when you can just observe them at home. So what I want to do is to give you some ideas as to when you need to be worried and when you can just be laid back about things. The first thing is to find out whether your child genuinely has a high temperature or not, and if they do, how high it is. Sometimes a child can be shivering or have cold hands and feet, and that can be the sign of a high temperature. On other occasions they might feel hot, but when you measure their temperatures they don't actually have a fever. So how should we measure temperatures? Best thing is a thermometer. Now, you can buy these strips that go across your forehead. They're not brilliantly accurate. The best thing is to get a thermometer that can either go under your child's armpit or in their ear, the electronic ones that you can buy at your local chemist, and they're pretty reliable. In younger babies under 3 months with a temperature above 38, you really need to get them seen by somebody. Even if it looks like it's just a viral infection, in younger babies a fever can signify something more worrying, and you should always get them checked out. So in older children, when do you need to be worried? When do you need to get them seen, and when can you just leave them at home and watch things? Well, there are a few what we refer to as red flag symptoms and signs that I want to tell you about. Firstly, if your child looks very pale or they have mottled skin, if their hands and feet feel really cold, if they're lethargic to the point that when you talk to them they don't really respond, all of those are signs that there could be something more sinister going on. If you notice that they're struggling with their breathing, so they're grunting when they're breathing out, or they're sucking their chests in, that can also be a sign that they've got more severe infection as well. An unusual high-pitched cry that is very different from their normal cry can also be a sign of significant infection, and that's another situation where you need to get them seen. And the other big one is if they have a rash that doesn't pass the glass test. The glass test is when you take a glass tumbler and push it over the rash and the colour doesn't disappear. If they're not pale and mottled, if they're reasonably alert, if they're drinking okay, don't worry too much about solids, just think about the drinking. And if their cry sounds normal, then it's less likely there's something more worrying going on, and you can probably initially manage them at home. Particularly if there's an obvious cause for the fever, such as a runny nose. In those situations, there's even less need to worry. So what should you do if you're not going to take them to be seen by somebody? Well, the main thing is to make sure they remain well and you can control their temperature. A temperature in itself isn't a bad thing. It's your child's immune system helping to fight off an infection. So if your child isn't uncomfortable with a fever, there's probably no need to do much about it in terms of cooling them down. If they're uncomfortable with it, if they're unhappy with it, then there may be some benefit to trying to get their temperature down. We don't really recommend tepid sponging anymore, but certainly don't overwrap them. Overheating them will just make things worse. Paracetamol and ibuprofen that you can buy over the counter are probably the mainstays of keeping a temperature down. You can use one or the other. You don't have to use both together, but one may work better for your child than the other, so experiment and see which is better. Don't overdose them. Go on the doses on the side of the box. As I said before, don't stress too much about solid food, but make sure they get good amounts of fluid into them, small amounts frequently. How do you know they're getting enough fluid on board? Well, if they're having wet nappies or they're weeing and their wee is a pale yellow colour, they're getting enough fluid on board. It's important to look for signs of dehydration. So if they're getting a dry mouth, if they're becoming more lethargic, if they're weeing less, if you notice their eyes look quite tired and heavy, or their mouths look very dry, they can all be signs of dehydration. And in a baby that's smaller with a soft spot, sinking in of the soft spot can be a sign of dehydration as well. And in those situations, think about getting them looked at. Most children with fevers you'll be able to manage at home. We wouldn't routinely give antibiotics just because you've got a fever. We'd give antibiotics if we felt that there was a bacterial infection somewhere causing it. And if your child has a fever that goes on for longer than 5 days, if your child, from the time they develop their fever, is becoming more unwell, or you're increasingly worried and they're not improving, or there's signs of dehydration or any of the red flag signs that we talked about before, get them seen. Most fevers in children are caused by viral infections, and they will get better without any help. And it's probably worth making sure you've got paracetamol and ibuprofen handy in your cupboard, because these things happen a lot.